Welcome back to Decode Healthcare with Harshal. Now, if you were hanging out with us for part 36 of this explainer series, you know we really dug into those complex sequencing flips for anemia and dehydration. Well, today, for part 37, we have a brand new mission. We are going to conquer section IC2E of the CMS ICD-10-CM official guidelines. We're talking specifically about encounters for chemotherapy, immunotherapy, and radiation. And let me just be perfectly clear right out of the gate. Failing to sequence the therapy Z code first on these routine encounters, it's a massive compliance error. It is literally the exact kind of mistake that triggers those automated insurance rejections. So today, we are going to master this rule, once and for all. Okay, let's dive into this. We've got a really focused roadmap for you today. We'll start with the Z code sequencing mandate, then break down the 3 exact therapy Z codes you need to know. After that, we'll tackle the multi-therapy combination rule, cover how all of this impacts compliance and your claim reimbursement, and finally, we'll take a quick look ahead at our next big topic, diabetes mellitus. All right, let's kick things off with Section 1, the Z-code sequencing mandate. Getting this wrong isn't just some minor typo. It actually completely changes the narrative of why that patient is in your facility. Think about a digital claim form for a second. I want to ask you directly, what goes in slot number 1 when a patient walks into an outpatient infusion center solely for their scheduled routine chemotherapy treatment? Do you put the breast cancer code first, or is it something else? I want you to really activate your prior knowledge here, because this exact scenario is where the high-stakes problem of sequencing flips actually occurs. And this brilliantly illustrates the dynamic we're dealing with. If you're putting the primary malignancy code into slot number 1 for a routine therapy visit, a warning buzzer should absolutely be sounding in your head. That is a major error. The correct way to do this is for that glowing Z code to slide into the absolute top slot, completely bumping the cancer code down to slot number 2. When the encounter is strictly a therapy encounter, the Z code always takes the principal position. Now, we aren't just making this up because it sounds good. This mandate is grounded in the ultimate authority, the CMS ICD-10-CM official guidelines for coding and reporting. Specifically, Section I.C.2.E.2 clearly states that you must assign the appropriate Z51 code as the first listed or principal diagnosis. And I really want to emphasize this. This rule strictly overrides any general coding habits you might have, any assumptions, or even older textbook examples. The official guidelines are the absolute law of the land here. Let's move on and see how this builds into Section 2, looking at the exact mechanics of the 3 therapy Z codes. So we know a Z code has to go first, right? But exactly which one? There are 3 core codes every medical coder needs to have permanently etched into their brain. If the patient is there for chemotherapy, you use Z51.11. If they are receiving immunotherapy, it's Z51.12. And if they are heading into the radiation oncology unit for external beam radiation therapy, you assign Z51.0. It's a strict guideline law. When a patient arrives at the facility solely to get their scheduled treatment, the cancer code loses its number 1 spot, and you absolutely must match the exact therapy type to one of these 3 codes. So, the crucial point is that the underlying cancer code doesn't just disappear, it simply gets demoted. The malignancy for which the therapy is being administered remains anchored safely in slot number 2, right beneath your therapy Z code. You are still telling the insurance payer exactly what type of cancer the patient has, for sure, but you are accurately reporting that the primary reason for today's encounter is the administration of the therapy itself. All right, moving right along to Section 3, the multi-therapy combination rule. Let's make sure we have all our bases covered for your professional coding toolkit. What happens when things get, a little more complicated? Imagine a patient comes into the outpatient facility, spends the morning in the radiation treatment room, and then moves over to the infusion chair for chemotherapy in the afternoon. It's a dual therapy day. So which therapy wins that coveted number 1 slot? The answer is they both do. You literally do not pick one therapy over the other arbitrarily. You must report both Z codes. Step 1 and Step 2 are going to be your Z codes. For example, Z51.0 and Z51.11, snapping into slots number 1 and number 2. And then Step 3 is your active malignancy code, which remains anchored safely right below them at slot number 3. Now, what's really interesting about this exact guideline is the phrase, "in any sequence." It proves the rules allow either Z code to be listed first, completely interchangeably. You could put radiation first and chemo second, or you could flip them. The automated claim scrubber will not punish you either way, just as long as they both precede the malignancy code. It's a really rare, brilliant piece of flexibility built right into an otherwise very rigid system. Let's shift gears a bit for Section 4 and talk about compliance and claim reimbursement. Why does this technical rule matter so much in the real world? Seriously, why spend an entire explainer dissecting the placement of a few letters and numbers? Well, because commercial payers and Medicare clearinghouses use hard-coded automated edits. If you list the transfer code as principal without the accompanying Z code, the claim scrubber will immediately flag it as an invalid reason for the encounter, and that delays your payment cycles. As the clinic's fraud squad, a fantastic concept from Buck's textbook, your job is to optimize the claim but never maximize or overcode. Getting this exact sequencing right ensures the facility gets paid correctly and on time. Picture an electronic health record billing interface right now. If you sequence the malignancy first, an error flag pops up instantly. Claim denied. Missing primary encounter code for therapy service. It's a hard stop. But once you correct that sequence and drop your Z code into the number 1 slot, the system dynamically updates to a clean, beautiful green, paid status. That right there is the power of knowing your guidelines inside and out. And finally, Section 5. Let's look at what we've got coming up next time with Chapter 4 Guidelines. We have officially conquered the strict Z-code mandate for cancer therapies. But, as you know, the guidelines are incredibly vast. In our next explainer, we are moving directly into Chapter 4 to take on the absolute giant of medical coding, diabetes mellitus. We're going to unpack the strict 5-tier category mapping, we'll talk about insulin pump failures, and that incredibly specific manifestation sequencing. So, the big question is, will you be ready to conquer the strict manifestation sequencing for diabetes next time? Make sure you subscribe, hit that notification bell, and absolutely share this explainer with your billing teams. Mastering these structured guidelines isn't just about avoiding simple errors. It's exactly what makes you an irreplaceable asset to any healthcare organization. Keep your coding accurate, keep your claims clean, and I will see you in the next explainer.